screen. Please read the question. So at least I'll be giving you 30 seconds for marking, but 30 seconds I'm giving you extra to read the question, since clinical based question definitely will be longer. So 40-year-old female presented with complaints of aggressive, frequent aggressive introvert behavior. She doesn't give much attention to the kids, right? And she stays isolated. She doesn't take part in family matter. Recently, she was talking to someone. Well, there was no one in room. Upon questioning, she replied that she was speaking to her grandmother. According to relatives, her grandmother died around 20 years ago. Okay, so there is hallucination, symptoms of hallucination, delusion as well. Okay, so according to relatives, she have died. Which of the following antipsychotics? Okay, so this patient has been diagnosed to be a case of psychosis, and which antipsychotic would you choose for this patient? So let us say you have already read, right, the question along with me, and here are your 4 options. If you want a little more time, I can give you a little more time also, but I think after reading the question, 30 seconds is more than enough to mark your answer. Okay, welcome all of you guys. For all those who have joined late, right, this is the very first question that we are having in the antipsychotic. Today is the clinical vignette series, and I hope all of you guys are going to enjoy this session, because psychosis, say, even in as a topic of CNS and also in the NIMHANS questions are always there. Okay, so around 27% of you, right, that is almost 1/4 of you have correctly marked the answer, right? 1/4 of you almost. The rest of the students have chosen the answer that is right other than the correct answer. So these are the students those who have maintained that. Now remember, guys, whenever we say psychosis, just give me at least 2 to 3 minute time. Since you guys are spending some time here, just allow me some time so that I can discuss this topic and you can conceptualize this topic once and forever. Whenever we say psychosis or schizophrenia, this psychosis and schizophrenia, guys, it will be having two kinds of symptoms. It can either be having positive symptoms and negative symptoms, right? So whenever we say positive symptom or whenever we say negative symptom, the basis, right, it is having two advantages. Advantage number one, that you can choose your therapy. Second advantage that you can get with the positive and negative symptoms, that how will be the prognosis. Any patient that is having positive symptom are always having good prognosis compared to the patient having a negative symptom which is having a poor prognosis. So what are the positive symptoms that we are having? Examples will be your delusion, right? Quickly I'll be writing here: delusion, illusion, auditory hallucination. Okay, auditory hallucination. Remember, guys, this auditory hallucination that we're having, characteristic feature of the psychosis that we're having is the third person auditory hallucination. Characteristic feature will be your third person auditory hallucination, right? Thought disorder, right? Thought disorder is also one of the positive symptom, right? Aggressive behavior. So this patient was also aggressive, right? There was a delusion as well. Aggressive behavior, right? Aggressive behavior and irrational conclusion, right? Irrational conclusion. She can make irrational conclusion that my fan is not working because, right, America doesn't want me to live peacefully, right? Or maybe my husband is doing that with me, my husband wants to kill me, or let us say some of my relatives are after me. Negative symptoms are poor socialization skills. So this person doesn't like to go out, doesn't like to meet people, right? Poor socialization skill, cognitive deficit. Example will be of cognitive deficit. These are all negative symptoms. Okay. Motivational lack. So there is a lack of motivation, right? Doesn't like to do much in life, right? Emotional blunting, right? Emotional blunting. Introvert behavior, doesn't like to go out, always like to stay inside the, right? Introvert behavior. So these are the symptoms that I have told you: introvert behavior, poor socialization skill. They are all coming under the negative symptom. And any patient having negative symptom, remember, guys, they are having poor prognosis, right? Poor prognosis. And any patient having positive symptom, remember, right? Positive symptom that we are having, it is your, right, good prognosis, right? Good prognosis. Another thing that you should know: any patient having positive symptom, all these positive symptom, remember, guys, they respond well to, right, response to your typical antipsychotics, right? They respond well to typical antipsychotics. However, the patient having a negative symptom, they respond well to, they usually respond well to, right, atypical antipsychotics, respond to atypical antipsychotics, They do not listen to the typical antipsychotic, right? So that is two differences that we're having apart from symptoms, right? The prognosis, right? And also, right, with which drug they respond well, right? Now, if you see here, right, if you see here, the patient is having symptom of both. The patient is having positive symptom and negative symptom, right? So remember this in all the patient, those who are having negative symptom and that those who are having the positive symptom, they all will be responding to the atypical. So if I have to give you a differences between the typical antipsychotics, and then I have to give you difference between the atypical antipsychotics, typical antipsychotics and atypical antipsychotics. The typical one, whatever typical antipsychotics that you're having, they are mainly acting by your D2 receptor blockade. They mainly act by D2 receptor blockade. And atypical that we're having, they are mainly your serotonin, right? They are mainly your serotonin receptor blockade. Remember, right? Serotonin receptor blockade is the main mechanism of action, right? 5st 2a. Apart from that, they are having some other mechanism of action as well. Like for example, they can also act by H1 blocking property, alpha 1 blocking property. They also have D2 and D4 blocking property. Other mechanisms are also there. Okay, other mechanisms are also there, but typical one is predominantly D2 receptor. Because of this particular region, they are having more risk of, right, more risk of your extrapyramidal symptom and hyperprolactinemia, right? Hyperprolactinemia, they are associated with the less risk of, right, extrapyramidal symptom, less risk of extrapyramidal symptom. That is what that you should know. Atypical is having, right, this is only for the patients with the positive symptom, and this is for the, right, positive and negative symptom both, right? Positive and negative symptom both के लिए atypical will be effective, right? Once you have seen all this, right, basic differences, right, basic differences that we're having, this typical one that we're having, it is only for psychotic disorders, right? Only for the psychosis, mainly it is used for the psychotic disorder only. But remember, the atypical or the newer one that we're having, right, it can be used for the psychosis, yes, right? Also can be used resistant cases of the psychosis, right? Resistant cases also can be treated using this class of drug. Can also be used as a mood stabilizer. They can also be used as a mood stabilizer. As a matter of fact, this class of drug, that is atypical antipsychotic, it is also used as a mood stabilizer in a manic patient, right? Manic patient may also it can be used, right? It is so safe that it is also preferred in the pregnancy as well. Manic patient with the pregnancy, this is the preferred drug of choice, right? Psychosis, resistant case of psychosis, as a mood disorder, right, as a mood stabilizer also it can be used, but this is mainly used as a, right, psychosis. Now on the basis of this information only, we need to find out that which of the following is a, right, atypical one. Yes, one thing is very sure, the patient is having positive and negative symptom both, and for positive and negative symptom both, which drug will be effective, guys? Typical or atypical? If a patient is having both the symptom, right, which drug will be mainly effective, guys? That will be your atypical. And out of this, which one is atypical? Out of this, which one is one drug that is atypical? Right? Atypical का नाम बताइए कैसे? Right? Right? Atypical that we are having is the risk, right? Risperidone. This is the only atypical that we are having out of the list. All others that we are having, guys, are typical, right? All others are typical. I hope all of you guys are very well aware which one is a typical drug, which one is an atypical drug, and you also know how to remember them in the examination as well, right? Risperidone, remember, this is considered as a most potent atypical, that will be your a risky drug, that will be a risky drug by the name of your risperidone, right? A risky drug by the name of risperidone, most potent atypical. This is also among atypical, it is also maximally associated with the extrapyramidal symptom and hyperprolactinemia, right? So remember, it's a risky drug by the name of your risperidone. I want you to read risperidone as a risperidone, okay? So risky drug risperidone, right? It is maximally associated with the extrapyramidal symptom and hyperprolactinemia. One of you are making a request to give the list of the drugs under the typical or under the atypical, okay? So the drugs that we are having, just give me a minute. Let me give you the name of the drugs. As I told you that there are typical drugs, Now under typical, we are having multiple subclasses as well. Like for example, one of the subclass that we have here, phenothiazines. Right, phenothiazine is one of the class. Right, the drugs under phenothiazine are drugs like your chlorpromazine, right, chlorpromazine, thioridazine. I am quickly writing here. I cannot write in all caps here, so I hope you can read it out also. Chlorpromazine, thioridazine, these are the low potency drug, right? Trifluperazine, right? Trifluperazine, right? Flufenazine, right? Flufenazine and perfenazine. Very good, Dr. Krishna. Perfenazine, right? These are the phenothiazine group among the atypical. Then among the atypical, you also have another subclass by the name of your butyrophenones, right? Butyrophenones, right? That will be your drugs like your haloperidol, right? Haloperidol, droperidol, right? Benperidol, right? Benperidol. These are the butyrophenones, right? Then another subclass that we are having is your thioxanthines, right? Thioxanthines. Remember, clozapine is a atypical है ना. डॉक्टर इर्तिका कादरी, डॉक्टर कादरी क्लोजापिन है ना, वो atypical है. डॉक्टर what I'm discussing right now is the typical drugs. Okay, thioxanthine that we are having is flupentixol, right? Flupentixol, zuclopentixol, flupentixol, zuclopentixol, right? And your thiothixine, right? Thiothixine. If you are sitting in your examination and let us say the examiner asking you question, or let us say in your viva the examiner is asking you question, how can you remember this? Now let me just give you a very simple way to remember. Phenothiazine, PT, right? PT sounds like patient. So whenever you write a case history, you always write patient as a PT, a 25-year-old patient, a 25-year-old PT, right? So patient की PT की करनी है CT scan, right? Patient की करनी है CT. You will be asking where to do. I will say ट्राई फ्लोर पर, राइट? एक बार फिर से देख लेते हैं. पेशेंट फिनोथायाजीन, राइट? फिनोथायाजीन पेशेंट की करनी है सीटी. यू वांट टू डू सीटी ऑफ द पेशेंट, यू विल बी आस्किंग सर वेयर टू डू. आई विल से ट्राई फ्लोर पर. आई होप यू कैन रिमेंबर दिस नाउ, राइट? पेशेंट की करनी है सीटी, वेयर विल यू डू, राइट? सीटी इज क्लोरप्रोमाजिन थायोडाजिन, वेयर विल यू डू? ट्राई फ्लोर पर. सो दैट इज योर ट्राइफ्लूपेराजिन, फ्लूफेनाजिन एंड परफेनाजिन. Who will be asking this question was that there was a beautiful nurse in this hospital who asked this question. She came and she said, hello Dr. Ben. Yes, very good, Dr. Kiara, right? Hello Dr. Ben. So you remember that this beautiful nurse who asked hello Dr. Ben, right? So butyrofenone, beautiful nurse, said haloperidol, that stands for haloperidol, droperidol and benperidol, right? Thioxanthines, right? So thioxanthine, what are the drugs that we are having? See, there is a flupentixol, right? Flupentixol. Now flu is Hindi is known as zukam, right? Flu in Hindi we call it as a zukam. So flupentixol, zuclopentixol, and in the flu or the zukam you make a coughing sound, right? A coughing sound. So flupentixol, zuclopentixol and thiothixine, right? Thiothixine, flupentixol, zuclopentixol, thiothixine, they are the thioxanthine group of drugs, right? So these are the typical group of antipsychotics, right? Typical. They are more associated with the extrapyramidal symptom. I hope all of you guys can remember that. Okay, phenothiazine एक बार रिवाइज करेंगे तो हो जाएगा, एक बार रिवाइज करना होगा घर पे, and definitely you will be able to recall it. Okay, then next that we are having are the atypical drugs. Next that we are having are the atypical one, that is mainly your 5-HT2C blocker, right? 5-HT2C blocker. These drugs are risperidone, the most potent atypical, right? Risperidone, right? Quetiapine, right? Quetiapine, right? Aripiprazole, right? Aripiprazole, right? Clozapine. This is the first question, doctor. Clozapine. But after this discussion, multiple questions we will be able to solve from this discussion only, right? Risperidone, quetiapine, aripiprazole, right? Clozapine, olanzapine, right? Ziprasidone, right? Zotapine, ziprasidone, zotapine, right? Acinapine, a recently approved drug. Acinapine is a recently approved drug that is available by the sublingual route, right? Right? Lurasidone, right? Certindone, right? Iloperidone, a recently approved one. Iloperidone, right? Paliperidone, right? Paliperidone, the longest acting one, right? Paliperidone, longest acting, right? Cariprazine, right? Cariprazine, that is having partial D2, D3 and D4 agonist. This is your partial. This is having partial D2 and D3 agonistic property. Partial D2 and D3, D3 agonistic property. There are a lot of drugs that I told you in the atypical. I'll tell you a very simple way to remember, right? Remember this atypical that we are having, a very simple mnemonic to remember. Rich queens, right? It's just a story. Rich queens are, right? Rich queens are, right? Molindone that we are having is some from the miscellaneous class, Dr. Irtika Kadri. We are having another class that is miscellaneous, that is neither in this class nor in the other class. Okay, so Molindone is actually miscellaneous class. Earlier it was in the atypical. They mainly considered as a miscellaneous group of drug. Okay, rich queens are clumsy for old zillionaires, right? Old zillionaires. So rich queens are clumsy for old zillionaires, right? Old zillionaires asking, right, love and sex in parked car, right? Asking love and sex in parked car, right? Rich queens are clumsy for old zillionaires, right? So just remember, rich queens are clumsy for old zillionaires. Risperidone, quetiapine, R will be aripiprazole, clozapine, olanzapine, ziprasidone, acinapine, right? Rich queens are clumsy for old zillionaires. Asking will be acinapine, that is sublingually available, right? Right, love and sex, that will be lurasidone, certindole, iloperidone, paliperidone, and the right cariprazine. All right. So these are the atypical ones. Remember that. I hope you can remember this. Even in the examination, phenothiazine patient की करनी है CT कहाँ करेंगे? Trifluor पर. Beautiful nurse saying hello Dr. Ben. Thioxanthines, that is flupentixol, zuclopentixol, and your thiothixine, right? So that will be about the first question. I hope it is clear to all of you. Now we can go quickly to the next question. Krishna, you can download this PDF at the end of the session. Once the session is complete, definitely you can download. Okay. Okay. A 40-year-old female with a history of psychosis started on first line antipsychotics. Now remember, before I finish this, today's session is for 90 minutes because I wanted to cover more questions here. So today's session is for 90 minutes. So please hold on to your bladders, right? That we are going to sit here for 90 minutes. A 40-year-old female with history of psychosis started on first line antipsychotic due to persistent symptom. She often missed to take drugs. Relative requests for alternative option which doesn't require to be taken on daily basis. You are about to prescribe a long-acting antipsychotic. Which of the following is the longest-acting injectable antipsychotic? So I hope you have been listening to me so far. And if you have been listening to me right from the last 20 minutes that I'm speaking, definitely you can mark the correct answer. Not everything can be written on this slide, but some things you need to hear and you need to recall. Right? I have told that twice during my session today. So remember guys, in this type of questions as well, the question almost remains the same. The question remains the same. It's just that the pattern will be a little changed. Okay. So around 40% of you, that is 38% to be precise, has correctly marked this answer, right? The correct answer that we're having is the paliperidone, right? Paliperidone is the correct answer. That can be, right? That can be given every 3 monthly. The question is asking about the injectable antipsychotics, okay? Injectable antipsychotics. Now there are total 8 injectable antipsychotics that we're having, okay? Out of the total 8 injectable antipsychotics, remember, there are 4 that are coming among the first generation, right? 4 that are coming among the first generation, and the other 4 that we are having that will be coming in the second generation, or also known as the atypical antipsychotics, right? Atypical. Okay. Now remember this. Out of them, if the examiner is going to ask you, which of the following is the longest acting, remember this paliperidone, it is acting right for 3 months, so it can be given, right? It can be given every 12 weeks. This is the dose, right? You don't need to remember the dose, but remember every 12 week it can be given, right? Every 12 week it can be given. And paliperidone, if you see, If you are going to give around deltoid region, or if you are going to give around the gluteal region, on the basis of that also the action can differ. So deltoid region पे it is lasting for around, let us say, 90 minutes. So remember one word, 90 minutes, and gluteal region पे 120 minutes. Okay. About the diluent, some of you are asking diluent पूछेगा कि नहीं. You never know ना डॉक्टर क्या पूछेगा, right? We do not know. But for your easiness, I'll just tell you, for the first generation, remember guys, you will be using diluent as a oil, right? Oil based. The second generation are all oil, water based diluent, right? Right. Aripiprazole, about what, doctor? Aripiprazole will be lasting for around 30 to 45 days, right? This is the aripiprazole that we're having. Dr. Shantan Basu, what's your question actually? What's your question actually? Longest time. I'm not getting your query. In this table, this is aripiprazole, right? Aripiprazole. इनके दो फॉर्म अवेलेबल हैं, aripiprazole monohydrate and or aripiprazole laroxil. What's your question actually? Longest, this is a steady state, right? Or the half life for the days, right? So this is roughly around lasting for around 120 days. Okay. Every 12 weeks you will be giving. So this is the longest acting, right? This is the longest acting, right? So that is about your injectable. That is about your injectable that we are talking about. This is the injectable that is given as a depot preparation. It is given as a depot preparation, deep intramuscular it can be given. Okay. Yes, penfluridol is the oral one. Very good. Yes. So penfluridol that we are having, it is among the oral, it is the longest acting. Among the oral, it is longest acting, and overall longest acting will be paliperidone. Overall longest acting will be paliperidone. You can see. If you want to remember diluent, simply remember second generation. I have given you already the names. They are using water, right? They are using water. Okay. So paliperidone is the longest acting. If paliperidone is not there, then you can go for the aripiprazole. Remember, if paliperidone is not there, right? Like for example, paliperidone is not there, then you can go for the aripiprazole, right? Aripiprazole is next in the order, right? Dr. Shantan Basu, I hope it is clear to you. If paliperidone is not in the option, you can go for that, right? So are we good here? The longest acting, oral longest acting, penfluridone, right? And paliperidone, that is the injectable paliperidone that we are having, it is the longest acting via the injectable one. Okay. Okay, to a hospitalized psychotic patient, while prescribing injectable antipsychotic, you have instructed the nurse to use oil-based diluent. With which of the following injectable antipsychotic uses sesame oil as a diluent? So see, very simple question, and I have just told you this, right? I have just told you this. I hope you can mark this easily. In which of the following you can use sesame-based? Okay. All 100% of you should mark this correctly. I have just told you this, right? Just told you that the atypical that we're having, atypical, they will be using water. Atypical will be using water, and rest of the drugs that we're having, that is among the typical, they'll be using the sesame oil, right? So around 67% of you only have marked this answer correctly, right? अभी तो बताया ना डॉक्टर्स कि जो आपका typical है, first generation है, they will be using sesame oil, right? Sesame oil. So correct answer that we are having, the only typical out of the list is your haloperidol. So सबसे पहले तो you need to know which one is typical, which one is atypical. So typical में I have already told you a lot of mnemonic like haloperidol, hello Dr. Ben. It's a typical antipsychotic from the class of the butyrophenols. Okay. A 45-year-old patient on long-term antipsychotic presented with complaints of decreased vision. Which of the following is true about the ocular adverse effect of the antipsychotics? Okay. Read the question carefully and mark the answer carefully, guys. Read all the option. Please read all the option. So around 30% of you have marked this answer correctly. Only 30% of you. That is for the reduced to 29, right? On an average, 30% of you have marked the answer, rest 70% have marked other answers. Some of the students they are still not marking. Now remember, if I have to summarize the ocular side effect of the antipsychotics, right? The ocular side effect of the antipsychotics. Then remember, it is your thyroidazine, right? Thyroidazine that can cause your retinal pigmentation. As a matter of fact, this retinal pigmentation among the thyroidazine, it is the only drug. Thyroidazine, it is considered the only antipsychotic that can cause your retinal pigmentation, right? Then the drugs like your chlorpromazine, right? Drugs like your chlorpromazine and your thyroidazine, right? They can cause your corneal opacity. They can cause your corneal opacity, okay? Corneal opacity, right? Drugs like your quetiapine that you're having, quetiapine, right? They can cause your cataract. Quetiapine can be associated with the cataract. So remember the mnemonic that was rich queens are clumsy for old zillionaires. Old zillionaires क्या करते हैं ना? There is millionaire, billionaire, and then there is zillionaire, right? Why? Because जो queen थी, rich queen, she was right. She was having cataract. अंधी रानी है ना? Rich queens for right for clumsy for the old zillionaires. Okay. Corneal opacity, not lens pigmentation, corneal opacity. Lens pigmentation will be right. Lens pigmentation or lens opacity same as saying cataract. Okay, lens pigmentation or lens opacity will be same as telling that the patient is having cataract. I hope you are getting my point, guys. Agar if a drug is causing lens right opacity, right, definitely it will be cataract only. Now read the option. Thyroidazine is the only antipsychotic that can cause retinal pigmentation. Okay. Quetiapine is commonly causes corneal opacity. It is the quetiapine that is commonly causes what, guys? Quetiapine commonly causes cataract, right? It does not cause the corneal cataract. Chlorpromazine is causing lenticular opacity, right? Again, right? Wrong. Clozapine can induce cataract. It is the quetiapine that can induce cataract. Clozapine that we are having, it is it can be maximally associated with the weight gain, right? It maximally associated with the weight gain and dyslipidemia, but not associated with your not associated with the cataract. Okay, not associated with the cataract. All right. So correct answer that we are having, guys, is your A, right? A. Yeah. Other side effect that we are having, clozapine ka other, there are a lot of side effect of clozapine. Agangliocytosis, sialorrhea, sedation, seizure. Okay, and wet pillow. Yes, because of the sialorrhea, they can wet down that pillow as well, right? Lipodystrophy. There are multiple side effect of clozapine. Okay. If you want, I can note down few of the important side effects because clozapine is also very important drug. All the students, just give me 1 minute, please. Clozapine ke liye, right? They can be associated with the side effect like your agranulocytosis, right? Agranulocytosis, sialorrhea. So they can also be associated with the wet pillow. Yes, they can cause the wet pillow as well. Sialorrhea, sedation, right? Seizure, right? It is maximally associated with weight gain, right? Dyslipidemia, right? Maximally associated with weight gain, dyslipidemia, right? That will be same metabolic syndrome में ही आ जाएगा. That will be same, calling the same. That will be metabolic syndrome, right? Metabolic syndrome. It is also the first anti-suicidal drug that has been approved. It is also the first anti-suicidal drug. So if there is a psychotic patient with suicidal tendency, I repeat myself again, psychotic patient with the suicidal tendency, it is the drug of choice. Okay, first anti-suicidal drug that is approved. Okay, also consider the drug of choice in resistant cases of schizophrenia. Resistant schizophrenia में, right, drug of choice. Then psychotic patient with a suicidal tendency. Okay, psychotic patient with the suicidal tendency, in that also it is considered a drug of choice. All right. So that is about clozapine. Some of you raised the question. We have discussed clozapine as well. The correct answer that we are having is A. There is thyroidazine is the only antipsychotic that can cause retinal pigmentation. That is the right. That is the correct answer. Okay. I hope all of you guys right have got this answer correctly. Now, right. Next question. While prescribing first generation antipsychotics, you are afraid of extrapyramidal side effects. Which of the following is true about extrapyramidal symptom of the first generation antipsychotics? You have to find out which of the following is true about, right? Which of the following is true about first generation antipsychotics? You'll have to find out, please do not mark which of the following. You'll have to find out a false statement. You'll have to find out which of the following is false about the extrapyramidal symptom of the first generation antipsychotics. Okay, please go ahead and mark. I have done some changes in the question so that around 50% of you have marked this answer correctly. Okay. So these are the students, those who have maintained the leaderboard. Now let us read the option once again, guys. You'll have to find out about the first generation antipsychotics. These are all first generation, like chlorpromazine, thioridazine. These are the first generation. Chlorpromazine, thioridazine, they are also considered low potency. So in the antipsychotic, there are two kinds of drug. One is known as low potency antipsychotics, and other one is known as high potency antipsychotics. So wherever there is a high potency, what do you understand by high potency, guys? In the general pharmacology, I told you high potency that we're having will be needing lesser drug, lesser dose. High potency means lesser dose पे काम करेगा, right? Low potency में you need to give a high dose, right? Now I have summarized it here so that we can save some time here. Now remember, low potency drug, example of the low potency drug are drugs like your chlorpromazine, right? Chlorpromazine, thioridazine. These are the example of the, right, thioridazine. High potency drug are drugs like your haloperidol, right? Haloperidol, or you can say as in short the butyrophenones, right? Butyrophenones, or you can say the thioxanthines, right? They are all high potency drugs, right? High potency drug. Now low potency drug that we're having, they are highly sedative, since you need a more or longer dose, higher dose for them. So they are actually highly sedative. They have more anticholinergic and autonomic. Although they are low potency, but they have more anticholinergic and autonomic side effect. Alpha 1 blocking property is also high, and the maximally alpha 1 blocking property it is seen with the chlorpromazine. Therefore, they are associated with the less risk of extrapyramidal symptom. And if the examiner is going to ask you overall, right, in the typical, remember, if the examiner ever is going to ask you that in the typical, right, in the typical, which one is having the least risk of extrapyramidal symptom, least risk of extrapyramidal symptom in the typical, that is your thyroidazine. High potency drug that we are having are the drugs like, your haloperidol, droperidol, right? They are causing less sedation, right? Lesser anticholinergic side effect, low seizure threshold, and right, lesser autonomic side effect. More potent antiemetic, but they are having maximum incidence of extrapyramidal symptom, and maximally with the haloperidol. Right? I hope this particular differences that we are having between the low potency and high potency is very clear. जो low potency है, you need to give high dose, and because of the high dose, there will be more sedative, more anticholinergic and autonomic side effect, and more alpha blocking property. But the high potency one, less sedative, lesser anticholinergic and autonomic side effect, but with the maximum extrapyramidal symptom. Now read the option. Chlorpromazine is a highly sedative. Yes, that's a true statement, right? Chlorpromazine has less risk of extrapyramidal symptom. That is also a true statement. Haloperidol causes less sedation because it's the right high potency drug. They will be causing less sedation, but least risk of EPS. यहीं पे rule out हो गया. This information I have given you already. So haloperidol causing least risk of EPS. This is a right correct answer here, because you have to choose one of the false statement. What did I told you already, that you will have to choose one of the false statement. Actually I wanted to put all of the following are true statement except, तो मैं except यहाँ type करना भूल गया था. So simply I put which of the following is a false statement. I hope it is clear to all of you, right, that the differences between low potency and high potency. Apart from that, one more difference that you should know about the extrapyramidal symptom. There is a lot of query that is ongoing about the extrapyramidal symptom, right? In the WhatsApp University or Facebook University, lots of queries and social over all the social media platform, that what is the extrapyramidal symptom maximally least, right? I'm going to summarize it all at one place for you, right? Remember, typical one is having more as compared to atypical. It is very well known to everyone. I hope there is no doubt in this. Now among the typical one, remember, overall maximally associated with your haloperidol, question number one, and least associated with, right, among the typical, least associated with your thyroidazine. I am talking about the extrapyramidal symptom. I am summarizing all the extrapyramidal symptom at one place. Okay. Then if the examiner is going to ask you overall least associated, least associated with, then the drug will be your clozapine, because clozapine is one of the atypical, right? Among the atypical, if the examiner is going to ask you among the atypical, extrapyramidal symptom maximally associated, AW is associated with, among the risky drug that I told you by the name of your risperidone, right? A risky drug that I told you among the, that is risperidone. So overall maximally will be typical one, that is haloperidol, right? And least will be thyroidazine in the typical. In the typical, least will be thyroidazine. Okay. All right. So this is one extrapyramidal symptom. Go ek jagah pe I have summarized all these extrapyramidal symptoms. I hope it is going to be clear to all of you. Okay. Next question. A 32-year-old patient